You're watching CoastLife, and when you think about the color purple, it can mean many different things. Maybe you think about a bundle of grapes or a beautiful lilac bush. But the color purple is also a powerful tool when it comes to the fight against substance use disorder and addiction. And here to teach us more today about this is Peggy Geisler, who is the Executive Director of the Sussex County Health Coalition. And you got your purple on already.
I do. I'm getting geared up.
Yeah, so geared up. So, of course, Delaware Goes Purple is in October, right?
That is correct. We start doing a lot of different things late September, but all through October, we really look at doubling down. All of our partners get engaged. We're really out in the community. There's a lot of events. We turn things up all over the state, the color purple, some of the bridges, some of the, the state capitol, all of those types of things to bring awareness, education, and to get our community engaged in this fight.
Yeah, absolutely. We know, on Delmarva Life we've gone purple, and on CoastLife we're going to go purple. Tell me just a little bit about kind of why the purple.
Well, Chris Herron came and we brought him to the States. He was an NBA player who fought addiction, and he's very outward facing, tells everybody about his journey and his story. But at one of his events, a little girl stood up and said that I plan on not to use while I'm in high school, and her friends laughed at her. She was wearing purple that day. And he decided to really say that substance use disorder and prevention, the color will be purple, and nobody should laugh or stigmatize somebody or tease someone for wanting to stand up for something they believe in, right? Which in this case was a teenager not wanting to engage in any kind of drug or alcohol.
Absolutely. So, can you tell us just a little, I know that substance use is happening more than we realize, and do you have any kind of statistics you could tell us about?
Well, sometimes you feel like things we're going in the wrong direction. Last year in 22, in the state of Delaware, we had the highest overdose rate, death, 527, and my argument is, could have been a lot more if we weren't doing all the work we were doing.
Yeah.
So this fight's not over. We still have a lot to do. Many of the drugs that are out there on the street are laced with fentanyl, at least 80% of them. That's really creating a lot of the overdose deaths that we're seeing, and also that we haven't even talked about the numbers of saves that EMTs and others are doing through the use of Narcan. So, I think we really need to be thinking about this. Our community needs to be prepared. Of course, don't get engaged in it. Let's prevent this starting at a young age. Let's help kids understand that. But as adults, we need to be ready, willing, and able to save a life. We're going to talk a little bit about this Yes, I Can Save a Life campaign. Yeah,
tell us a little bit about that. It's Yes, We Narcan.
Yeah, which with the capital CAN, can save a life, really. It's really about getting people to be willing, just like with CPR, get trained, carry it on you, save a life. Yeah. It's really that simple. I think people are really worried about two things. One, the administration of it. If you've ever had a nose spray, it's very similar. It's really easy to administer. But second, in the state of Delaware, if you are a volunteer and there's a Good Samaritan law, if you were to save a life, they can't sue you. I mean, I think people are worried about being involved. Really? We can't afford not to be involved. That's somebody's brother, sister, daughter, mother, aunt, uncle, child.
Yeah. Absolutely. And really anybody could get trained in how to administer Narcan.
Absolutely.
Right?
And there's a lot of places you can go and get it for free. They're getting ready. I think it's something that you can get over the counter in pharmacies coming up. I think that's changing soon. But there's a lot of community events. There's lots of training. Yeah. If you want to host a community event, if you want swag for your community event, reach out to us, www.healthysussexcoalition.org. We can help you with that. If you want to do an event around this, awareness or prevention, we can give you all the materials you need to do that.
And I love that you guys are so about partnering with the community and sharing with different businesses. And so if somebody is interested, if different businesses are interested, do they just contact you?
Yes, they can. We're going to be probably flashing up a URL code and our contact information. Please do. Yeah. We have many businesses, over 100 businesses a year usually get engaged in this initiative. If you aren't one, be one. We'd like it to be 200.
Yeah.
I mean, it takes all of us. We make assumptions of who might have an addiction issue. Yeah. I mean, the highest use of drug in the state besides heroin and those types of opioids, right, are also alcohol. It's a gateway drug. Yeah. People are suffering because of addiction. Doesn't matter whether it's opioid addiction, whether it's cocaine, whether it's benzodiazepines, whether it's alcohol. Yeah. If you are fighting that, issue or someone you love or know is fighting that issue, reach out.
Yeah.
There's a lot of Help is Here in Delaware is a website you can go to. They're one of our partners. There is a lot of resources there for you or your family member, but in the meantime, help us prevent it. Help us destigmatize it. Help us get the information out that's important to save someone, because yes, you can save a life.
Absolutely. Peggy, you're obviously very passionate about this. Where does that come from?
I think in my own life, I've had friends, family who have either been addicted or overdosed. One of my cousin's daughters died. I think it's really important to understand it touches everyone.
Absolutely. And you mentioned, obviously, the statistics the numbers are not great. How do you guys keep going? What do you use for motivation to keep going, even when the fight is still so hard?
When you talk to people who've lost their children, tell me one reason why we shouldn't.
Yeah. Absolutely. And there's so many more of those people than we would probably even realize.
Right. So the reality is that nobody wakes up one day and says, I want to be an addict. What we really want to do is help people not go down that road or journey. You don't have to be alone. There are people who will support you, whatever you're going through. You don't have to turn to drugs or alcohol. If you don't want to go out with friends who are drinking, there are other friends who won't be drinking. If you don't want to stay where you are and you want to get recovery you want that to be an option for you, there are people ready, willing to receive you and help you. Yeah. It's your choice at that point, but there are people to support that choice. There are options.
Yeah, absolutely. Obviously, Delaware Goes Purple coming up in October. What can we do now to prepare for it?
Reach out, join the crowd, get pledges, to get people to start pledging. That's a pretty easy way to do it. There's no cost associated. Plan an event. You've got a 2-month runway.
Yeah.
Right? Plan an event.
Yeah.
Let's get out there and let's be ready for October and let's get that message out.
Yeah. Peggy Geisler, who's the Executive Director of the Sussex County Health Coalition, thank you so much for coming in today and talking about this. Anything else folks need to know?
No, we just look forward to seeing you out there, right?
Absolutely.
And being part of this journey. We still a marathon, not a sprint.
Yeah.
It's not going anywhere anytime soon. So help us, help others, be safe, and to recover.
Absolutely. All right, Delaware Goes Purple coming up.